Bowel disease can cause discomfort and pain for a lot of people. Learning how to manage and cope with the pain adds even more difficulty to one's lifestyle. Joining us this afternoon to talk more about IBD and how to treat it is Dr. Michael Hernon, a colorectal surgeon at Hartford HealthCare. Good afternoon. Thanks for your time.
Hi, how are you? Thank you for having me.
Absolutely. Can you first just tell us what is inflammatory bowel disease and how common is it?
So inflammatory bowel disease is a chronic relapsing inflammatory condition of the gastrointestinal tract. The GI tract in all of us basically helps kind of absorb nutrients, eliminate waste, and basically allow us to absorb and process food. The two main common types of inflammatory bowel disease are ulcerative colitis and Crohn's disease. They are different conditions. They do vary in a lot of different ways and they manifest. Crohn's disease is involved in basically a full thickening inflammatory state of the intestinal tract that can actually affect both anywhere from the mouth to the anus. Ulcerative colitis is usually solely kind of involves and affects the colon and the rectum. So they're very different kind of conditions, and they do have some overlap, but they are kind of different in terms of the way we treat them and things.
And what are some of the symptoms and causes of ulcerative colitis and Crohn's disease?
The cause of inflammatory bowel disease is actually very multifactorial in nature. It really has kind of a broad kind of diagnosis and etiology. It kind of is, there is definitely a genetic component. We do see this kind of genetic kind of inflammatory process that basically affects people in different states and so forth. And also there's definitely an immune kind of cascade that involves kind of inflammatory bowel disease, impacting the immune system that actually starts fighting our GI tract and causes this inflammation and these bad cases of it. And there's also an environmental exposure. So it's definitely kind of a multifactorial environmental genetic and immune kind of cascade that causes inflammatory bowel disease.
And do you have any suggestions for people and how to manage both of these?
The management and the diagnosis is usually by a gastroenterologist, and the mainstay of kind of treatment and so forth is usually medical in nature. It all decides on how severe and how severe our symptoms are. Most symptoms are related to just kind of abdominal pain, diarrhea, crampiness, bloating, can sometimes have some bleeding in their stool. And really the mainstay is to try to manage those symptoms. And they basically kind of have a broad variety of treatments we have. For mild cases, it's usually anti-inflammatory medications. We affect the medication that allow the inflammation to become quiescent and allows people to go into a relapsing nature of their inflammatory bowel disease. The immune modulators are definitely kind of a tier up. Those are for more people that have moderate to severe Crohn's or ulcerative colitis. And those impact the immune system that allows our body to kind of make the immune system quiet and prevent it from attacking itself in terms of the gastrointestinal tract.
All right.
And we have newer medications, biologic therapies that are much more beneficial in terms of kind of really targeting people in a more moderate to severe cases of inflammatory bowel disease.
Wonderful. Very informative. We appreciate your time, Dr. Michael Hernon. Thank you.